Okay, it's recording.
Okay, yeah, it was on 60% yesterday, and now what they're giving her is down to 50%, which means that they don't have to give her quite as much oxygen to get her levels up. It's just they're still having to, they give a lot of help, a lot of pressure to kind of keep the lungs open, so the air is moving through there. Okay, that's what the ventilator does.
Right.
So. But as they come down on the oxygen, that means it's starting to get better, right?
Yes.
Okay. But we treated her for pneumonia. We treated her kidney, or we've been observing her kidneys, and they're recovering. They're getting a little bit better. Okay.
Good.
So the kidney numbers should go back to normal. And then they're also they're giving her Lasix to try to get a little fluid off. Just if there's any fluid building up in the lungs, that slows your progress. So they're working on that. Okay.
Okay.
And just as they start to see these things get better, and then
She's got fluid other places too, and that'll.
I
know
so. Yeah, because I didn't really.
I could hear when they had the external catheter. I could hear it. Just she was really going a lot.
Really.
Yeah, which was good.
She's getting a lot of urine out. But when I look at her, she's not like terribly swollen or anything. I mean, everything's
okay.
So, but they just try to keep them a little bit on the dry side. Try to get as much fluid off as possible. So, because any extra fluid in your body kind of builds up in the lungs when you're like this.
Mm-hmm.
So they're taking a little fluid off. But her kidneys are working well, so that's good. It's just takes time for this to heal. She's got all the appropriate medications, that they give, the steroid and the other things for COVID.
Okay.
And then, it just takes time. And as she starts to get better, breathing a little better on her own, then they'll reduce some of the pressure that they're giving her just to see if she can handle less assistance with her breathing. And as they do that, then they'll be able to get her off the ventilator in the next few days. I don't know. That's up to them, and I can't
predict. Up to a
predict.
week, hopefully.
Yeah, over some short period of time.
Please, God.
Yeah, I hope so. Because if it goes on too long, then they have to start thinking about putting the tube into the neck, a trach into the neck. I don't know if you've heard of those.
Mm-hmm.
Because if the longer this other one is in there, it can get scarred in here and then close up, and that's a problem. So then they have to do this thing if they.
Oh, please, God.
Yeah, hope not. But
hopefully not.
Yeah, that's their goal. They're going to keep working with her, see if they can get her off before they have to do anything drastic like that. But
okay.
it is.
We got an army praying for her.
Well, good.
So.
That's all you can do right now.
Yeah.
They take care of the little things that pop up along the way, but mostly it just has to heal.
You guys are wonderful.
Yeah,
it's so much appreciated.
Okay. Yeah, but that's kind of what they're dealing with right now.
Oh, so have they changed any of her meds, or? I know that they were giving her antibiotics for what is possibly a bacterial pneumonia.
Yeah, they were covering that. But
antibody therapy.
Mm-hmm. And the medicine for COVID, which I can tell you the name of it here real quick. It's this one here. It's called baricitinib.
Yeah, that's the antibody therapy, isn't it?
Yeah. It's the
antiviral
see
that.
thing. Yeah.
I don't know if I'll ever
That's one of the COVID
zoom in on that or see it or not. I don't know.
Baricitinib. Okay.
You'd think I'd be able to spell or say that by now. I've typed it out so much.
Yeah, right. And that's one that, she's on the third day of that, but that's one that they'll give, let's see, I believe it's for up to 2 weeks until she's better. So,
okay.
Yeah, they changed her sedation a little bit. They had to switch her sedation over. Sometimes if the one they give, the propofol, is really good, but if it builds up in your system, it can give you a little bit too much of fat calories. It can start to spill over into the urine. So if they see that, they switch it over to another one, and I think they did add some different stuff. But they're just trying to keep her.
They did.
So she can sleep.
They had changed it yesterday, and she was somewhat alert, and she was able to communicate with me with the wiggly eyebrows and the.
Good.
Squeezing my hand and such, which to me seemed like a miracle because I was afraid I might not be able to communicate with her at all for a while, for maybe not ever. The way they talked to me, I was so scared.
It's always it's a scary thing.
So it was really wonderful yesterday, and she gave me permission to take a little video of her.
Okay.
So I was able to share that with the family and friends and. It was wonderful. Made me feel really hopeful, but I was being anxious person that I am, I was afraid to call today to find out what was going on. Too good to be true, kind of.
Yeah.
I was worried. I shouldn't be.
She's certainly, if anything, she's moved a little bit more positive.
That's awesome.
Nothing bad came up. So.
Good.
Okay.
Good. Thank you so much.
Okay, well, we'll try to call you or something every day. Okay.
Okay. I know you guys are wonderful, and I really appreciate you very much. I'm going to stop this now.